Hello, everyone. My name is Salim Hayek. I'm a cardiovascular specialist in cardio-oncology and the chair of the American Heart Association Cardio-Oncology Subcommittee. Joining me today is my dear friend and colleague, Dr. Amelia Langston, who's a co-author on the statement. Dr. Langston is a prominent physician scientist and the director of the bone marrow transplant at the Emory Winship Cancer Center. So until recently, we didn't have good data on the contemporary incidence of cardiovascular complications. The recent studies have elaborated on that, and there's some good news here in the sense that in the acute transplant phase, cardiovascular complications do occur. These are mainly atrial fibrillation, flutter, and acute heart failure. Atrial fibrillation and flutter are the most common, from anywhere from 5 to 10%, as you mentioned. Heart failure, less common, but not surprising given how much fluid these patients experience, along as that systemic inflammatory response that comes with engraftment. Cardiovascular death, however, is extremely rare during the transplant process. 100 days after transplant, and up to 5-10 years, that's when we really see the burden of cardiovascular disease occurring in these patients. And that is why the survivorship becomes an even more important, the cardiovascular management. And so when an oncologist refers a patient to us, what we look at is really trying to understand their cardiac reserve. And what I mean by cardiac reserve is their ability to tolerate these fluid shifts and this inflammatory process in large volume that are being administered during transplant, and really preparing or guiding the transplant team as to what they need to expect. In my practice, our job is not to tell folks, no, you can't go through transplant, but really to prepare them, optimize them, and getting them to the best shape possible from the cardiovascular standpoint for going through transplant. This statement goes through that thinking and really describes this concept of cardiac reserves.
And I think this is a very, very important point that you make, Salim, because think about the aging of the population. We now transplant patients into their late 70s in some cases. And so the incidence of baseline cardiac comorbidities is high when you get into those age ranges. And looking at the other extreme, we also are talking about children and young adults who have their whole life to live. And so the survivorship piece becomes incredibly important because the incidence of cardiovascular complications in people who are transplanted when they're very young is actually very high and may be very significant to their long-term health and functioning.